Uh, Good morning, everybody. Welcome to our Veterans Workshop. All of you new branch presidents, I know we had an election this year, and I know a lot of them don't know who I am, but I'm the state veteran chair. I'm president of the Kokomo branch. And I need to tell you a little something about myself. For those of you who don't know me, the new president's coming on that's going to get their veteran chairs started, committees in their branches, hopefully. But I'm the president, I'm formally now the president of the Kokomo branch NAACP. And I'm a native of Guthrie, Kentucky, and graduated at Todd County Training School in Elton, Kentucky. Following graduation, I served in the U.S. Army 101st Airborne Division as a combat medic. I served in the USAR 5030 uh, at Grissom Air Force Base. I was a recruiter for the Army Reserve, was an instructor at Fort Benjamin Harrison Supply School in Annapolis, Indiana. I was deployed to the Middle East in 1990 during Desert Storm. I was a sergeant first class. I received the Army Commendation Medal from Lieutenant General William Bagonas. I retired from the military in 1992, in which I had done 25 years for our country, counting reserves and active duty. I was the first Black training NCO for the 199 Supply Company at Grissom Air Force Base. I received an associate degree from Ivy Tech in 1975 for auto technology. I went on to receive a BS degree from Indiana Wesleyan University, business management. I spent 35 years at Chrysler Motor Company, in which I was an engineering technician. I was the first Black that have ever had that capacity. I worked on the first front wheel drive transmission to be tested at the Kokomo transmission plant. I retired from Chrysler in 2009 as the assistant benefit rep. I was the chairperson for Human Rights Committee of Local 1302 Union, engineers, clerks, and technicians for 17 years, in which I argued a number of civil rights cases for the union. I spent 30 years working with the NAACP, in which I am now a current member of the state board as chair of the Veteran Committee. I have a life membership in the NAACP. I also was president of the Human Rights Committee of Kokomo. I'm married and have two children. And I'm gonna leave in the chat my uh, phone number, and I'm gonna need my email for you presidents to reach out to me if you need any help with setting up your veteran committee. But I have two excellent presenters today, and one, Lisa Washington, who's gonna start off first, and she's the Minority Health Director of Howard County. And I also have State Representative John Bartlett from the State House in Indianapolis, Indiana. And with us today, I have Willie Stroman. He's our moderator, and he's going to moderate the chat for us today. So if you have any questions that you want to address to us, I would like for you to put them in the chat so that he can, at the conclusion of our workshop, he can uh, direct them to the presenter that the questions are asked to. And in my area, I know all over the state, we have veteran hospital. In my area, we have three. In Annapolis, we got Ratterbush, and we got one in Fort Wayne. It's with the North Campus. It's at 2121 Lake Avenue, Fort Wayne, Indiana. The phone number is 1-800-360-8387. I'm telling it kind of fast because I'm gonna put all these numbers in the chat. But the other one that we have, I've already talked about Rattlebushe and Fort Wayne, and we've got what we call the South Campus is in Marion, Indiana, and it's at 1700 East 38th Street. The number for that, the toll-free number for that is 1-800-360-8387. As you know that we are saying these are veteran hospitals. And when we say veteran hospital, we are talking about veterans' health. Because as you see, I was a medic in the Army. I was handling you on active duty as well. I think about your health while we are retired. But for some of the checkups and tests for men at the hospital, excuse me, it's good to have a regular checkup, but you have to have testicle exams, cholesterol testing. These are what the hospitals provide. Prostate cancer screening, as well as colon cancer, blood pressure check, aortic aneurysm. Then that we do HIV testing and diabetes testing. Also, they give dental checkups, eye exam, and skin exam. I could go on and on, but John Bartlett is our state representative. I don't know whether you can see this book or not, but this is the Bible to the Veterans Committee. We have here a John Bartlett, I'm gonna have it in the chat, his address and phone number, which he will be addressing us in the workshop. Any veteran committee need this, you get in touch with me, or you can get in touch directly with John, and they will send these to your branches. And without any further ado, I would like to present my first presenter, and that's Miss Lisa Washington. Are you ready to take over, Lisa?
Good morning. As Rossi said, my name is Lisa Washington. I am the Executive Director of Minority Health Alliance of Howard County, and that is a coalition of Indiana minority health care. And what we work on in, I believe, 23 counties throughout the state, we are a unique nonprofit organization. What we work on is decreasing health disparities, particularly in minorities. And so we do a lot of work on chronic diseases such as diabetes, cancer, respiratory diseases. So what I have prepared today is a presentation for you on some diseases that affect minority populations. And so I'm going to try to share my screen. So my screen is up, correct, Willie?
Let me unmute myself. Yes, you're looking good.
Okay, all right, perfect. Okay.
I will be your check and balance here, okay?
Okay. So let me see if I can get it to go forward. Oh, hold on. Hold on. I just got to figure out how to go forward. Can you get my slides to go forward, Willie?
No, not yet. You're still on the very first slide. There's an action at the top that says, says start. Presentation. You go to the first slide. You hit the down button, that should get it. Let me see here.
Oh, I got it. Okay,
Got it? Okay, there we go.
got it.
Good deal.
So when we look at Indiana, we have a population of not quite 7 million. And for those of us who live in Indiana, we know that for sure it is a predominantly white population. All over 80% are white. Not quite 10% are African American. 6% are Hispanic or Latino. We have about not quite 3% who are what we would call biracial, 2% Asian. So that's what we see here in this state. But what we know that is going to happen probably in about, they project by 2045, is that there's going to be a change in the overall population in the country. We can kind of see some of that, and I'm not going to get very political with that, but what we saw in the last election is kind of a forecast of what's going to be. We know that the minority population is going to supersede the white population. So one of the areas that we know that's going to take the most growth is going to be the Hispanic population. They are projected to be at about 17%, African Americans at about 16%. And you take a look at the rest of those, Asian Americans at 6%. That kind of accounts for some of the political things that are going on. But why that's important from a health perspective is we know that there are lots of diseases that primarily affect African Americans, minority populations at higher rates than the white population. And there are lots of reasons why we think that happens. Some of it, they've done lots of medical research studies on these, lots of social studies on these. It has to do a lot with economics, socioeconomics. When we look at, for instance, and I'm going to talk about diabetes, but that's one that they've really studied. A lot of it has to do with what can you afford to eat. When we look at the diets of Hispanics and Black Americans, we know that those are, they have a high concentrations of carbs. And so if you are already at risk for those things, what can you afford? The cheapest things usually are the things that are least healthy for you. So when we look at veterans, and I am honored that Rossi asked me to speak to you because my dad was a World War II veteran, and he moved here to Indiana. He died several years ago. So I do have some experience with working with the VA. He served in World War II, and I found some of these statistics very enlightening. We have about, at last count, over 400,000 veterans living in Indiana. Marion County, in terms of numbers, has the largest numbers of veterans living here. But when we look at per capita, Miami County has the largest per capita number of veterans living there at 9%. In Howard County, at one time, which is where I am currently residing, we were able to get Jackson Street Commons, which is an apartment complex for homeless veterans. And so that is something that we've been able to do for veterans. Before the COVID pandemic, I was able to go down and work with the veterans. And once maybe we get some of the COVID numbers to go down, I might be able to go back down there. But it's interesting if you look at the numbers there on the side there, if you see where the number of veterans are. So if you look at that 65 to 74 number there, you see over 100,000 veterans. And so that number is interesting because of where as I go through the presentation, you'll see that, as we age, we do tend to be more at risk for certain disease processes. And sometimes there's several committees that I sit in on, and there are some people who don't access the veterans, the VA system as they should. I shouldn't say as they should or as they might choose to, but it can be of real benefit to them, just to help them get some services that they might need. So then, oops. Hold on. My computer is not cooperating with me.
It gets like that sometimes, but you're doing good.
Let's see here. There we go.
Yeah, we got plenty of time.
Okay, so when we look at health outcomes in Indiana, and this is another thing that we work with at Indiana Minority Healthcare, Indiana does not do well in this area. So when we look at health outcomes, what we're looking at this is a measure of our quality of life in our state, because that is a measure of how long people live and how healthy they feel. So, one of the things that we really do, this is one of the things that we're working very hard at with the coalitions of Indiana Minority Healthcare to do a little better with. They measure these outcomes, and we had several years ago managed to climb out of the 40s, which we were sitting at the very, very bottom up until the 39th. But if you take a look, you'll see that we are not doing so well. And some of that has to do with smoking, some of it has to do with drug abuse, and some of it has to do with obesity, cardiovascular problems. So when it comes to smoking, we are 41st. When it comes to obesity, we are 40th. And when it comes to diabetes, we're 37th. So when we look at drug abuse, and I can tell you, I've been a nurse for about 30 years, this is one thing that we've struggled with. And for the African-American community, this is a problem that has plagued us for quite some time. It was a crack epidemic in the 80s. Now, what has happened to white America, and this is just my opinion, is that now we have opioids that has hit middle America. And so now it's a problem that has really been looked at. And I know even here in Howard County now, we have systems of care that is building communities for the opioid recovery for them to live in. And so it's not uncommon in this community to see where Narcan is being given several times a day. It's not uncommon to see where the coroner has to go out and pronounce people dead from overdoses. One of the legislators told me when we went down to Indiana that this was all, I'm trying to think of the word he told me, but he told me it was really just based on stories that people were telling. There was no real evidence of it. But, we've known for a long time that there's evidence on drug abuse. And the Surgeon General, Jerome Adams, he really helped Indiana Minority Health and the rest of Indiana In Scott County several years ago, people may remember when we had the huge hepatitis and HIV outbreak. He talked a lot about, the beginnings of that. So in some communities, what was happening is someone may have gone to the doctor, some young, maybe a young athlete got a injury. The doctor put that person on a narcotic for the injury, and the person may have become dependent on that medication, couldn't get it anymore, and then went to a street drug like maybe heroin, which was very cheap. And that's how they started using IV, maybe heroin or some type of IV medication. And I took a leadership class here in Kokomo, and some of the police officers who actually were on that drug task force told us that in some of these instances where these people really become dependent on it, whether they're smoking it, whether they're shooting it, some of the big police officers, 6 feet, 250 pounds, they couldn't even go in the house because it was so smoke filled and there was so much drugs without them passing out. So it's a real epidemic. It's a real problem. And so, it was anecdotal. That was the word the state rep told me. He said it was anecdotal. But we know it's a real problem. So there's no question about that. But you can see all of those things kind of lend to why we're having the issues that we're having. Then if we look at obesity, this has been another health condition that has not only plagued Indiana, but we certainly do not do very well with it here in Indiana. So when we look at obesity, what we're looking at is we're looking at a BMI, and that's a body mass index. And so that compares your weight to your height. And if you are above 30%, they absolutely consider the person obesity. And one of the issues with someone who is obese is that it can actually lead to that person losing some years of their life. It can contribute to chronic diseases like heart disease, type 2 diabetes, stroke, cancer, and hypertension. It also, when we look at some of that, we know that some of the things that lend to that are a poor diet. So as I said, when we look at socioeconomic factors, sometimes what is going on is sometimes the only things that people can afford are the cheapest things. And sometimes the cheapest things are the things that are not as good for us. So for example, fast food. You go to McDonald's and, it's cheaper to get a value meal, because I think now they have a special. You get like a value meal and then you get another one for free or for half price, something like that. So those are the things that have led to some of the diet. The things that are cheapest in the store, the things that are highest in carbs, and I'm going to talk a little bit about that when I talk about diabetes here in a few minutes. The other thing is our physical inactivity, our physical environment, and we can't forget about genetics. The one thing that we cannot change, someone can have bariatric surgery and that can correct the problem. But if the person has the surgery and they don't follow the doctor's instructions, and they have genetics that lend to obesity, the problem will not stay corrected, and medical history. And the other thing that we know, and I'm going to talk about COVID-19 at the very end. So you may have heard that one of the risk factors that we think makes people not do so well if they do contract COVID-19 is obesity. So that's the other one. So We know in terms of other things, when someone is obese, it makes the heart work a little harder, so they can become hypertensive. They may have sleep problems. They may have problems breathing. They may be at risk for cancer. And certainly, it can lead to some mental disorders. Sometimes they become socially isolated. They can suffer from some depression and anxiety. They get that social stigma based on their weight, and that leads into just that circle of mental illness. And the other thing, when we talk about mental illness, we know in the state of Indiana, and I can tell you in Howard County, other counties may be different. We have a shortage of psych doctors and therapists. So it becomes very hard for them to tackle that. And with COVID-19, everything has been done virtually. And that is not always a very good, if someone is having issues, it's not, it gives them some support, but sometimes people, when they're going through an acute crisis, if they're talking to someone on a screen, sometimes they get very upset, or if it's depression, they really don't want to talk to someone on a screen. They want to see somebody face to face. So those are some of the other things that lead to that. So when we, one of the things we do at Indiana Minority Healthcare is we can either virtually, certainly before COVID, we were going out into the community and we were working with community groups, and we were giving some presentations on obesity and weight loss. We could have personal trainers go out and work with people. But we certainly want to work with them on weight loss. And we tailor that to what's most appropriate for that person. We certainly wouldn't have a personal trainer who is going to make them work so hard that they never want to see a gym or a dumbbell or an exercise bike, that they never go back. But we want to help them and find out what can help them change their lifestyle that's going to work for them. And I already talked about behavioral changes. So we really need to find out if it's their dietary habits, what can we do that will work best for their dietary habits? We realize that there are lots of people who go to food pantries to get their food. And so we work with them on some healthy tips on how they can still get their food from the food pantry and make it healthy. So, one of the things that we work with them on is, for instance, if they're getting canned vegetables, sometimes that stuff is high in sodium. We work with them on rinsing that out, getting the sodium if they're hypertensive, so that we can bring some of that sodium off of it. And we want to sit down. A lot of times I see people now one-on-one, and so we work with them and see just exactly what is going on. The other thing that we like to do is we twice a year, we do go down to the state capitol, and we do talk to our legislators who are representing our district. And we talk with them we try to find out what policies they're working on. And we ask them, what can we do in the community to support the policies that you are putting in place? And if there's anything related to these health issues, we like to work on that. Some of the things that not so much on a Indiana local level, but some of the things that have been suggested maybe at a national level are increasing the price of these sugary drinks, getting them out of the schools, because we know some of these behaviors are learned at an early life. Again, some of these evidence-based obesity programs. I worked on a project at Darrell Chapel, which is a local preschool here, to have safe routes to schools. There was it was on a major street here. And so some of the parents had expressed a wish to do some biking. And then we worked on getting a yellow light implemented so that people would slow down some. And then we also do a healthy exercise and healthy eating that we do with the young children. And now that we're virtual, we can't really do that so much, but I think I've done that program about 3 or 4 times, and the kids really like it. I have a personal trainer who comes in and does the exercises with them. And we teach them things that they can do. Instead of playing their video games, we do a screen time where we have them actually tell us how much screen time they're using. And it's actually, I think, quite shocking to the kids because they will tell us they don't use much screen time, and almost every one of them walks in with a phone, an iPhone or an Android, and they will tell us that they don't watch TV, but they use their Android all day long. So that's one of the other things that we do. So now we'll talk a little bit about diabetes. So diabetes, we have about 320 million people living in this country. Close to 10% of our population has been diagnosed with diabetes. So some of the other things that are more concerning as healthcare providers is we have about 7 million people who are undiagnosed. And we do health screens when the coronavirus isn't interfering with us. But it's not uncommon for people to know that they're not diabetic. We, on occasion, have found people who will come in with a blood sugar of 300, and we have to refer them back to their doctor, or we have a local organization called Project Access, and they can help people if they don't have insurance, get in with a provider to get them started working up. But the more concerning number is this number of pre-diabetics that we have. So a pre-diabetic is someone who has a blood sugar that is anywhere from 100 to 125, and that's a fasting blood sugar, or they have a hemoglobin A1C, which is that number that the doctor can run, and it will tell you what your average blood sugar is running for the last 2 to 3 months. So if you have an A1C of 6 or greater, well, I should say about 6, you are considered a pre-diabetic. Now, when we put some of those numbers together, instead of the 10%, we now know we've got about 121 people in this country who are affected by diabetes. And why that can be an issue is the cost that it can cost to the economy. So about $245 billion. And that's looking at medicines, that's looking at lost wages. So we know that diabetes is a toll. So when we look at diabetes, who's most at risk for developing what we call type 2, which is adult onset? So if your doctor's ever told you you're pre-diabetic, if you're overweight, if you are 45 years or older, if you have what we call a close relative, so a parent, a brother, a sister, a mother, a father, you are at higher risk. If you are active less than 3 times a week, the American Heart Association recommends 150 minutes of exercise per week. If you are a woman and you have been told you have gestational diabetes. So that means you developed diabetes as a result of pregnancy, or you gave birth to a baby that was greater than 9 pounds. That type of diabetes usually goes away after the birth of a baby, but it does put you at increased risk for diabetes. If you are a member of a minority ethnic group, so if you're African American, if you're Hispanic, if you're an American Indian, if you're an Alaska Native, you are at greater risk. So what do we say we want you to do? We want you to, one, the most doctors and healthcare providers are very good at screening their people. We want you to look at your eating habits. We want you to get away from that screen and do some exercise. We want you to, if you are diagnosed, we want you to do some things to protect your organs. So diabetes is a disease that can impact your eyes, your kidneys, your heart. We want you to be able to not have any end-stage organ disease. If you know people who have, I've taken care of lots of people. When I worked in Michigan, I saw lots of people who had to have an amputation as a result of diabetes, lots of people who had to go on dialysis, lots of people who had to have open heart. So those are the things that, and sometimes people have issues with their eyes. Those are the things we want to protect your organs. So that's why it's so important to keep your numbers in control. So and the doctors and healthcare providers know this because there have been lots of studies that have been done over time. So they know if they keep you in good blood sugar control, they can reduce the risk of you having any eye damage by over 70%, kidney disease over 50%. The other one is nerve disease. So if you've ever, there's a movie, I always know I'm going to forget the name of it, but it's, there's a matriarch in the family, and at the beginning of the movie, she burns herself and she doesn't realize she burns herself. As the movie progresses, she ends up going into the hospital for a simple procedure. She ends up with almost every complication there is. She ends up on dialysis. She ends up having a stroke. And she ends up actually dying in the movie. So those are the kinds of things that we want to prevent. So diabetes is can be it can hit many of your organs. So again, we want to reduce that cardiovascular risk. They know if you have good blood sugar control, over 40%, a non-fatal heart attack, stroke, over 50%. Again, as I said, they diagnose you at 6. If you are diagnosed as a diabetic, they want to see that hemoglobin A1C between 7 and 8, because they know that your blood sugar is hitting somewhere between 150 and 180, which is what they consider good blood sugar control.
Thank you, Lisa.
Oh, I'm done? Okay.
Yeah, we have John Bartlett on there, state representative. Will you please take over? John? Thanks, Lisa.
Yes.
Great presentation.
Thank you. Can you hear me?
Mm-hmm.
Okay. Good morning, everybody. I wanted Lisa to go first, and it's a good thing I did because I am IT challenged, and I struggle trying to get on, so had to have some help. And thank you, Rossi, for helping me out to get on. First off, let me say thank you to all the veterans that have served this country. Thank you for your service, and thank you for what you've done for us and made us safe in this great country. My job is to give you let you know what's going on in the State House this year. From my perspective, I filed some bills, and I will share with you some of those bills. one of the things that we neglect to address in the United States, in the great state of Indiana, in my opinion, is human trafficking. And it affects us all. Before the pandemic hit, it was a $210 billion a year industry. That's with a B, $210 billion a year industry. And it comes in four parts. You have the sex trade, you have the slave labor trade, you have the human organ trade, and you have the breeding trade. That's where they capture young girls, breed them, and sell the babies. The human organ trade, you can Google how much are human organs on the black market, and you'll see that your body parts will bring in about $235,000 from one human being. And so the money is what motivates. And we're not addressing that on the federal level, and we're not addressing it on the state level. Yesterday, or day before yesterday, they had a bust in Greenwood, Indiana, just south of here, next county over from Marion County, and arrested probably about 20 people for soliciting children, trying to capture children to put into the human trafficking. So it's real. It happens here. In 2018, we had a bust in Indiana with the state police and the federal police, and they arrested 128 adults, and they were able to recover 82 women and children, and the youngest child was 3 months old. So it's something it's a nasty business, and you'd be surprised at some of the names that you'd run across in that business. But it's a high dollar business, and if the leaders and the orchestrators of this are millionaires and billionaires. So that's something we need to be aware of. I got a bill well, it's actually a resolution just making January is Human Trafficking Awareness Month, and we want to recognize that in the state of Indiana, so we will be doing a resolution for that. Also, last year, for the last 2 years, I've had a pilot program that I've been trying to get started, which would bring, if you receive public assistance, we want to take you off of public assistance. We want to pay you an hourly wage for 40 hours, but you must go to school. You must maintain a C average. In order to be in this program, you must have a child or children. And also you have to volunteer at that child or your children's school 32 hours a month. The reasoning for that is our parents have gotten away from being included in their children's education. And I believe that if that parent is going up to that school, volunteering for 32 hours a month, they see what's going on in the school, they see what the teacher's up against, and they see what little Johnny and little Susie's doing at school. So that brings the family back together. So I think that's a huge piece. After 40 hours, you come off of public assistance. And the only way you can ever get back on public assistance is through a court order. So if you had a special situation, Lisa talked about amputations to where you could not work and you had to go back on public assistance, those kinds of things would get you back there. But we feel like if you can do get a 4-year degree or get a vocation or both, as long as you can do it in 4 years, because the state's going to pay for your education. As long as you can do it within 4 years, you're good, and you get that 40-hour wage for 4 years. Once you come off of that, and there are some special classes you have to take, such as financial management, first-time home buyer, parenting classes, and we want to make that family whole again. And we want to take you off of public assistance so that you become a taxpayer rather than a drain on the tax system. But then that pride comes back to whereas you're not waiting on somebody to give you something, you're making your own. And I think that's huge. Here in Marion County, we have something called slating convention. And that's where the different parties come together and pick the candidates that they're supporting for the primary. I think that that's a violation of federal law. And the reason I say that is that it's pay to play. And that's just wrong. As a state representative, I don't go through the slating process. I've not gone through it for the last 4 years. After I figured out that it was wrong, I don't participate. And because of that, I was the only incumbent in Marion County that was not endorsed by the Democrat Party, but that's okay. It's another conversation. But just for the record, I did win by 79% of the vote. But if you're 27, 28 years old, married, got 2 or 3 children, and you want to run for state representative, now you think back to when you was 25, 27 years old, how tight money was. So they want you to put up $1,500 in February. So if you win slating, you don't get your money back, okay? So if you lose the primary, you just donate the $1,500 to the party. But even if you win the primary and win in November, you do not start getting paid until January of the next year. So you got $1,500 you have to let lay for 11 to 12 months. If you're young, I don't care how smart you are, what you would bring to the political arena, you can't afford it. Paying that $1,500 up front if you're a young person with a family. And I just think it's wrong. So I have a bill to do away with that. And I had breakfast with the mayor Monday, and he told me that this time that he will support that bill because it is wrong and it needs to go away. Criminal justice. That program, somebody sent on chat, the program, the pilot program, it's a pilot program to fund education attainment is the name of that program. But criminal justice has become a big deal since George Floyd. But for the last 3 years, I filed a bill for criminal justice reform, an intensive study, because they were talking about defunding the police, but defunding the police is, in my opinion, not the right thing to do. Our whole criminal justice system is broken. The state of Indiana's constitution says we will not use criminal justice for vindictive punishment. That is exactly what we do. We do not reform inmates. We put them there, we punish them. We don't protect them in the prisons. They're being raped in the prisons. They've been mistreated in the prisons. And yes, they made a mistake. They did wrong. They had to pay that debt to society. But that's not the way to do it. Okay, so like we need to study that. The Chief Justice, the Speaker of the House, well, I met with the Speaker of the House, and he is in favor of the bill, and I think we'll get a hearing on it this time. And I asked for a Republican co-author this time, because yes, if you do wrong, you go to court, you have to pay that debt to society. But I want that debt to be equal. I don't want a white male who has the same criminal profile that I have to get 2 years and I get 10. If we have the same criminal profile, we should get the same time. And that's not happening, and it hasn't happened in America. Depending on who you are, it's what kind of time you get. And 97% of the people who are in federal prison are there on a plea bargain. 94% of the people who are in state prison are there due to plea bargain. And why that's dangerous is if I didn't do anything and I get arrested, and my public defender comes, and I say, sir, I didn't do anything. I wasn't there. He said, yeah, I know, but they've charged you with 18 counts. You're looking at 65 years. If you plead guilty to these two, I can have you out of here today, and then when you come back to court, you're probably doing 2 months probation. But now you have a criminal record, or you got 65 years facing. If you plead guilty to these two, you get 2 years, do one, you're back home in 12 months. And you've been here for 30 days. So that time counts as well. So now I'm in prison for something that I didn't do. But if I didn't plead guilty and went to court, I may get 65 years. So if I plead guilty, I only have to do a year. Although I didn't do anything, I'll take that plea. And back in the old days, they used to put you up against the wall and put screws in your hand till you admit it. You did whatever, or they will put boulders in your chest till you admit it that you did, whether you did it or not. They would get a confession from you, and they use a bunch of counts and time to get you to confess to something you didn't do. They've solved this crime over here because you confessed to doing it. They get that off the books. They get you out of the system, get you out of society, you in prison. And let me share this with you as well. In 2011, all of the legislators got a letter from CCA, Corrections Corporations of America, saying, if you will let us take over your prisons and you guarantee us a 90% occupancy rate, we will guarantee you a profit. That's the way they think about you being in prison, filling the beds and making the money. And we don't understand all that. Stuff happens from the criminal justice system that you wouldn't think anybody that's an elected official, anybody that's in control would do that. They had a judge in Pennsylvania who was arrested and is doing time right today because his brother-in-law was in charge of a juvenile system, and they needed to fill the bed. So people coming through the juvenile system, this judge was sentencing them so he could fill his brother-in-law's juvenile jail. The juvenile jail became profitable, but then they found out what was going on. So they arrested that judge, and he's now doing time. So our criminal justice system is broken all the way through, and we have to learn what's going on with that. Our legislature should be held accountable. And folk, I'm telling you, stop electing folk and send them to the State House or to City Hall or to the White House and not follow them. Hold them accountable. You hold John Bartlett accountable. And I tell my constituents all the time, know what I'm doing. If you disagree with me, say something, because I can explain to you why I'm doing what I'm doing, or educate you as to why I'm doing what I'm doing. And if it doesn't fit what you want as your representative, we need to have that conversation. Maybe you can educate me to some things I don't know. So hold those folk accountable. Don't just select someone and send them someplace and you don't know. Another bill is I want the state police to take over these police investigations. I want citizens on that. And it's in the bill that the state president of the NAACP is on this commission or their designee. And some other citizens are on there as well. But I want it to be a state unit to investigate all abusive force by policemen, because what happens is when you have this local group, like here in Marion County, if IMPD is policing IMPD, it's like, Rossi, I know you and man, you've been on the police department together. So, oh, Rossi's a good dude. He's a friend of mine. So I'm going to overlook a lot of stuff. But if you have a commission set up by the state or the state police and some citizens from across the state are part of this, and when there's an abusive force by a police officer, that police officer goes through the state commission and not through a local position, because then it's uniform. Everybody has to go by the same standards, and especially police action shootings. So if I'm robbing the bank, and police shoot me in my leg, I don't think that should go before the commission. If I'm in a chokehold in a George Floyd situation, those situations should go before this commission, and they should respond to that.
Hey, John.
Also, yes, sir.
Thank you. We got 5 minutes left in the workshop.
Uh-huh.
I would like for Willie Stroman with the question. Would you please ask those? Do you have them? Willie? I don't think he can hear me.
Okay, here, I'm unmuted now. Okay, anyway.
You ready for the question?
Okay, well, really, everyone must have done extremely well because we only have one question. There are no questions for the health or Lisa's presentation, but there is one question for you, John, and this question is asking the name of the program that you was talking about, whereas helping those with public assistance, there's a program associated with that when you was talking about it. And the question is, what was the name of that program?
The pilot program is to fund education attainment. Fund education attainment.
Fund education attainment.
Right. We
Okay.
just filed that bill again this year, and I don't have that number yet, but I will have it. My phone number is 317-545-1341. And as early as Tuesday, I should have that bill number.
Could you repeat that number again, John?
317.
Okay.
545-1341. And anything that you need to know about the any bill that I have, you can go to H95 at iga.in.gov.
John?
Yes, sir.
Could you please tell them, the veteran chairs, how they can get these Indiana veteran benefit guides?
Send that.
Office
yes, right. Go to that same email address and request them, as many as you need.
You got that, everybody?
Why don't you go ahead and repeat that email address and I'll put it out there, John.
H95 at iga.in.gov.
And by the way, you can, that email address, you can request these Indiana Veteran Benefit Guide booklets when you contact him. And John will be sure to send you out as many copies as you need for your branches. We appreciate everyone for participating in the veteran workshop this year. And I really am looking forward to getting in touch with you again next year when we meet in Lafayette, Indiana. So again, I want to say thank you. And that is all we have for today. Excellent.
Hey, brother, President Tolliver, I did put the email address and also John's contact information in the chat room for everyone to see.
Wonderful.
Thank you for the invite.
And thank you, guys.
Thank you. Wonderful, wonderful program. Thank you.